Assalamu alaikum, beta. In this video lecture, I will deliver the lecture on carcinoma of the endometrium. That is a complete malignant condition. Okay. In the previous video lecture, I delivered you endometrial polyps. Okay. So let's start with the malignant condition, that is carcinoma of endometrium. Okay. By the way, this is the most common invasive cancer of female genital tract, up to 7%. फीमेल के अंदर जितने भी इन्वेजिव कैंसर होते हैं उनमें से 7% is the carcinoma of endometrium. Okay, and worldwide, there are up to 280,000 new cases of endometrial cancer per year. So per year, it's kind of very much mesmerizing to know that there are 280,000. It's a big number. Okay, per year. Now there are two categories or two types of the endometrial carcinoma. One is type 1 endometrial carcinoma, that is endometrioid variety, and here is type 2 endometrial carcinoma, that is serous variety. In this video lecture, I will deliver all about this type 1 endometrial carcinoma. Okay, so type 1 also called endometrioid variety, and type 2 is the serous variety of endometrial carcinoma. The type 1 endometrial carcinoma, it appears in what age, beta? You can see here 55 to 65 years of age. And type 2, that is serous variety of endometrial carcinoma, it loves to appear in this age group of 65 to 75 years. Okay, so both they do appear in post-menopausal age. Okay, the clinical setting in which these appear, beta, the type 1 endometrial carcinoma, it appears in the clinical setting of endometrial hyperplasia, and type 2 appears in the clinical setting of endometrial atrophy and the thin physique of the individual. Okay, what did I mean to say? Let me tell you that type 1 endometrial carcinoma, it arises in the clinical setting of endometrial hyperplasia. That means if somebody is suffering from endometrial hyperplasia, that there are chances that it will develop into endometrial carcinoma. What type of endometrial carcinoma? Type 1. Okay, and if it is not endometrial hyperplasia, it is endometrial atrophy, then endometrial atrophy may develop later into carcinoma of the endometrium, and it will be type 2, that is serous variety. Okay, so be careful and remember the clinical setting of each. And you remember endometrial hyperplasia, beta, it may be due to unopposed estrogen therapy, obesity, hypertension, and diabetes mellitus. If you want to have better understanding of this topic, you can go and check the very first video on endometrial hyperplasia, right? Okay, thin physique is, by the way, is also having role in the development of, or this thin physique, may be associated with serous carcinoma. Okay, what are the precursors of the type 1 and type 2 endometrial carcinoma? The type 1 endometrial carcinoma, its precursor is hyperplasia. That means if you develop endometrial hyperplasia, it will develop into type 1 endometrial carcinoma. But the precursor of type 2 endometrial carcinoma is serous endometrial intraepithelial carcinoma. This is very important term to keep in mind. Serous endometrial intraepithelial carcinoma. This is very important term. Also, you will learn similar term in the malignancies of ovary, where it will be STIC, that is serous tubal intraepithelial carcinoma. Okay, in case of ovary you will learn. Okay, the precursor of type 1 endometrial carcinoma is hyperplasia of the endometrium. If you develop endometrial hyperplasia, it will develop into type 1 endometrial carcinoma. Okay, but in case of type 2, the precursor is different. The precursor is serous endometrial intraepithelial carcinoma. Okay, if you develop this ACIC, it will later develop into serous endometrial carcinoma. Beta, mutations which are involved, the genes which are mutated in the type 1 variety and the type 2 variety, which you will better understand when we will start each type separately. The mutations you can just see here involved, the very important mutation in case of type 1 is P10. This is a tumor suppressor gene. Okay, you will see how this is mutated and what are its effect later when we will be discussing it. Okay, the other genes involved are ARID1A, phosphatidyl inositol kinase 3CA, KRAS, fibroblast growth factor 2, MSI, and CTNNB1 and TP53. Okay, these all are the genes you need to keep in your mind, okay, which are mutated in case of type 1. In case of type 1 endometrial carcinoma, but in case of type 2 it is a little different. The genes involved are TP53, there may be aneuploidy or PIK3CA, that is phosphatidyl inositol kinase, or FBXW7 CHT4 triple P2R1A. Okay, these are the genes which you have to remember that they may be mutated, and these type of genes are mutated in type 2 variety, that is serous variety. Okay, the behavior of type 1 endometrial carcinoma is indolent. That means it is not aggressive. It is slowly growing and it does spread, and it spreads via lymphatics. Okay. If the type 1 endometrial carcinoma develops, it will show indolent behavior, and if it spreads, it will spread via lymphatic channels. Okay, but as compared to this type 1 variety, the type 2 endometrial carcinoma is very much aggressive. It is not indolent, it is aggressive, rapidly growing. Okay, and it spreads intraperitoneally and lymphatic spread. Okay, so it means it spreads by the lymphatic channels, as well as it will spread directly into your peritoneum. Okay, now we will be discussing the type 1 endometrial carcinoma. Type 1 beta endometrial carcinoma, that is also called endometrioid variety, it is most common type. It is 80%, okay, as compared to type 2, which is serous variety. And by the way, most of the type 1 endometrial carcinoma, they are well differentiated, and they mimic the normal proliferative endometrial glands. Okay, and therefore they are referred as endometrioid carcinoma, because these type 1 endometrial carcinoma, they are very much well differentiated. Okay, they are not poorly differentiated, they are well differentiated, and they mimic the normal proliferative style of the endometrial glands. They do proliferate the way normal endometrial glands used to proliferate. Okay, and these type 1 endometrial carcinoma arise in the setting of endometrial hyperplasia. This is what I told you on the previous page, that first you develop endometrial hyperplasia, it will then later develop into type 1 endometrial carcinoma. Okay, can you better let me know in the comments what was the precursor of type 2 endometrial carcinoma? Yeah. Okay, as I mentioned, if you develop endometrial hyperplasia, it will develop into endometrial carcinoma. What type of carcinoma? Type 1. Okay. The mutation mainly involves PTEN mutation. PTEN mutation first lead to development of endometrial hyperplasia, and it will later grow into carcinoma. So this is the mutation which is present in hyperplasia as well as carcinoma. But later I will tell you there are some other mutations as well that are only present in carcinoma. So because carcinoma is growing, you can see this is a hyperplasia and it is the precursor of carcinoma. So carcinoma must be associated with these conditions. Why? Because hyperplasia occurs due to all these conditions. Obesity may lead to endometrial hyperplasia. Diabetes mellitus, hypertension, infertility, and unopposed estrogen therapy. If you want to have better understanding of all these things, better go and watch the very first lecture on endometrial hyperplasia. So all these things, all these conditions, they lead to development of endometrial hyperplasia, and endometrial hyperplasia develop into type 1 carcinoma. Now let me tell you about all the mutations which are involved in type 1 endometrial carcinoma. Out of all those mutations, the very important mutation is, which I just told you, is loss of function mutation in tumor suppressor gene PTEN in up to 30 to 80% cases. Okay, and the other mutations include a gain of function mutation in a proto-oncogene, that is PIK3CA, right? by the way, this mutation is not an early mutation. This is not an early mutation. And by the way, it does not occur in the atypical hyperplasias. देखो, आपको मैंने बताया ना कि P10 जो म्यूटेशन होती है वो पहले हाइपरप्लेजिया में होती है, एटिपिकल एंडोमेट्रियल हाइपरप्लेजिया में, फिर उसके बाद इससे कार्सिनोमा बनता है। इसका मतलब यह है कि P10 म्यूटेशन तो दोनों में करी हुई ना, हाइपरप्लेजिया में भी कार्सिनोमा में भी। लेकिन जो गेन ऑफ फंक्शन म्यूटेशन है PIK3CA में, it is rarely occurring in atypical hyperplasia, suggesting that PIK3CA plays role in invasion, not in the development of the carcinoma. So the summary is P10 mutation is present in both hyperplasia and then carcinoma, but this PIK3CA mutation is not present in hyperplasia or present rarely. So we can say that PIK3CA mutation is mainly present in PIK3CA mutation is mainly present in carcinoma, and this mutation develops later in the carcinoma. इससे पता चलता है कि PIK3CA जो म्यूटेशन है वो कार्सिनोमा को बनाने में इतना हेल्प नहीं करती, बल्कि कार्सिनोमा की जो लेट स्टेजेस हैं, जब वो इन्वेड करता है टिश्यू में, उसमें उसका ज़्यादा रोल होता है। ठीक है। अच्छा, PIK3CA के अलावा दूसरी म्यूटेशंस, गेन ऑफ फंक्शन म्यूटेशन इन प्रोटो ऑन्कोजीन KRAS in 25% cases. Okay, and number 4 is loss of function mutation in tumor suppressor gene ARID1A. Okay, by the way, normally this ARID1A is regulator of chromatin structure. It regulates the chromatin structure. Okay, and if there is loss of function mutation in this gene, you think this gene will be regulating your chromatin structure anymore? No. So there is loss of function mutation in this tumor suppressor gene ARID1A in 1/3 of the tumors, and the same mutation is sorry, the same mutation is also seen in this same mutation ARID1A. Same mutation is also seen in ovarian endometrioid and clear cell carcinoma. These are two malignancies of ovary. One is ovarian endometrioid carcinoma and clear cell carcinoma. These two are the conditions of ovary. Okay, and the same type of mutation is also seen in these two conditions of ovary. Okay, right. All these mutations beta we just discussed, loss of function mutation in P10, gain of function mutation in PIK3CA, gain of function mutation in KRAS, and loss of function mutation in ARID1A. All these mutations are going to do what? Increase a growth pathway, that is PI3K ACT signaling pathway, and once this pathway is overactivated, it will lead to the development of endometrial carcinoma. Okay, now you understand how these mutations participated in the development of endometrial carcinoma, right? These are the main mutations. Okay, few other mutations you need to keep in your mind are not really important. The main ones we discussed above, 1 2 3 4, but some other mutations that include mutations in the DNA mismatch repair genes. Mutations in the DNA mismatch repair genes, जो जीन्स DNA को एक्चुअली, जो उसमें DNA में जो टीयर्स आते हैं, जो ब्रेक्स आते हैं, उसको जो रिपेयर करते हैं जीन्स, उन जीन्स में म्यूटेशन आ जाए. So it is not only seen in, it is seen in case of sporadic endometrial carcinoma in 20%, but the same mutations are also seen in familial cases. Okay, तो कहने का मकसद ये है बेटा कि आप फ़र्ज़ करें ये एक जीन है और इसका काम है DNA को रिपेयर करना. ठीक है, इसका क्या काम है? DNA को रिपेयर करना. और अगर इसमें म्यूटेशन हो जाए तो आपका DNA रिपेयर नहीं होगा और मज़ीद म्यूटेशंस जमा होती जाएंगी, एंड इट विल लीड टू डेवलपमेंट ऑफ एंडोमेट्रियल कार्सिनोमा. ओके, एंडोमेट्रियल कार्सिनोमा, एंड दिस टाइप ऑफ म्यूटेशन इज सीन in both the cases, sporadic cases and familial cases. Familial cases, especially familial cases of what disease? Familial cases of HNPCC और Lynch syndrome. वो families जिनमें ये दोनों diseases रन कर रही हैं, उन लोगों में ये mutations common होती हैं और वो लोग familial endometrial carcinoma ज़रूर develop करते हैं. What is this HNPCC? It is hereditary condition of the colorectum, that is hereditary non-polyposis colorectal carcinoma, okay, and the Lynch syndrome as well. So again, I'm like kind of making this thing clear in simple desi explanation that this is a gene, its function is to repair the DNA, okay. But if let's suppose there is mutation in this DNA repair gene, this mutation or this silencing of this gene may be by, for example, epigenetic silencing, epigenetic साइलेंसिंग कैसे होती है बेटा, ये तो बेसिक जेनेटिक्स है. एपिजेनेटिक साइलेंसिंग बाय हाइपर मिथाइलेशन. अगर आप इस जीन की ये जो जीन बेटा डीएनए रिपेयर करवा रहा था, इस जीन की अगर आप हाइपर मिथाइलेशन करवा देंगे तो ये साइलेंट हो जाएगा. और जब ये जीन साइलेंट हो जाएगा तो डीएनए को मज़ीद रिपेयर नहीं कर पाएगा. और जब डीएनए रिपेयर नहीं होगा तो डीएनए कमज़ोर होगा. और जब डीएनए कमज़ोर होगा तो और म्यूटेशंस को अक्वायर करेगा. और ये ऊपर वाली म्यूटेशंस अक्वायर करके एंडोमेट्रियल कार्सिनोमा करवा सकता है. ठीक है, तो हमने देखा कि जब ये डीएनए रिपेयर जीन जब ये म्यूटेट हो गया बाय हाइपर मिथाइलेशन तो एंडोमेट्रियल कार्सिनोमा डेवलप हो गया. ठीक है, इस तरह की म्यूटेशंस स्पोरोडिक केसेस में भी देखी जाती है अप टू 20%. और इस तरह के म्यूटेशंस फैमिलियल जो केसेस होते हैं उनमें भी देखने को मिलती है. फैमिलियल केसेस वो फैमिलीज जिनमें HNPCC रन करती है या लिंच सिंड्रोम रन करता है. ठीक है, एक और आखिरी म्यूटेशन बेटा दैट कैन बी participating in the development of endometrial carcinoma type 1 is loss of function mutation in the tumor suppressor gene TP53. It is not present in all the types of type 1 endometrial carcinoma. It is only present in what type of type 1 endometrial carcinoma? Poorly differentiated type 1 endometrial carcinoma. And by the way, this mutation is not present in early part of the cancer. It is present in the late part of the cancer when the type 1 endometrial carcinoma has developed very much. Then in the later part this mutation occurs. And what is the purpose of this mutation? This mutation actually helps the tumor to progress further, to invade the tissue further. Okay, so this type of mutation, don't forget, this is present in poorly differentiated type 1 carcinoma and it is lacking in well differentiated type 1 carcinoma. Okay, yeah. So now you understand all the mutations that are leading towards endometrial carcinoma. Now I will explain you better the morphology part of endometrial carcinoma type 1. Talking about morphology of type 1 endometrial carcinoma, that is also called endometrioid variety. How does it appear grossly? अगर आप grossly इस टाइप 1 एंडोमेट्रियल कार्सिनोमा को देखें तो ये कैसा दिखता है? इसकी अपीयरेंस दो तरह की हो सकती है बेटा. इसकी अपीयरेंस दो तरह की हो सकती है. या तो इट मे बी लाइक अ लोकलाइज्ड पॉलीपॉइड मैस. इट कैन बी अ लोकलाइज्ड पॉलीपॉइड मैस और डिफ्यूजली इन्फिल्ट्रेटिंग एंडोमेट्रियल लाइनिंग. तो आप अगर फ़र्ज़ करें ये एंडोमेट्रियम है तो आपका टाइप 1 कुछ इस तरीके से भी हो सकता है, पॉलीपॉइड मैस, या फिर ये कुछ इस तरीके से भी होता है, डिफ्यूजली इन्फिल्ट्रेटिंग द एंडोमेट्रियल लाइनिंग. इट इज़ डिफ्यूजली इन्फिल्ट्रेटिंग. ओके, एंड दिस टाइप 1 एंडोमेट्रियल कार्सिनोमा, हाउ डज इट स्प्रेड बेटा? इट स्प्रेड्स बाय मायोमेट्रियल इन्वेजन टू एडजेसेंट स्ट्रक्चर्स. ये देखें बेटा, ये आपका फ़र्ज़ करें ये एंडोमेट्रियम है. ठीक है, एंडोमेट्रियम के नीचे मायोमेट्रियम होता है, उसके नीचे पेरीमेट्रियम होता है. तो फ़र्ज़ करें ये एंडोमेट्रियम है और आपके इस एंडोमेट्रियम में ये टाइप 1 कार्सिनोमा मौजूद है. तो ये इन्वेट कैसे करता है बेटा? इस मायोमेट्रियम के थ्रू इन्वेट करके आसपास के जो स्ट्रक्चर्स होते हैं, ऑर्गन्स होते हैं, उनमें जाता है. जैसे कि लिम्फ नोड्स में इट कैन गो फार अवे टू द लंग्स एंड द लिवर एंड द बोन्स. ओके, एंड बाय द वे इट कैन आल्सो इन्वेड broad ligament of ovary, if I am not wrong, or the uterus. You will better understand this ligament and the anatomy part. But if you just trust me beta and you just now keep it in your mind that if the type 1 endometrial carcinoma invades the broad ligament of kind of your reproductive system of the female genital tract, broad ligament, then there will be palpable mass in your lower abdomen or the pelvis. Okay, right. Yeah, this is the gross explanation of this type 1 endometrial carcinoma, its appearance and spread. Now I will tell you microscopy of this type 1 endometrial carcinoma. Under the microscope, this type 1 endometrial carcinoma is of three types. Under the microscope, there are three histologic grades or types of type 1 endometrial carcinoma. It may be well differentiated or grade 1, or maybe moderately differentiated or grade 2, or मतलब कि poorly differentiated or grade 3. Okay, well differentiated or grade 1 is okay. हम टाइप 1 एंडोमेट्रियल कार्सिनोमा को कब कहेंगे कि ये वेल डिफरेंशिएटेड है, ग्रेड 1 है? जब उसके अंदर ऑलमोस्ट एंटायरली ग्लैंड्स मौजूद हों, ओके, और जो स्ट्रोमा है वो अब 5% या उससे भी कम हो, ठीक है. सो व्हेन यूर टाइप 1 एंडोमेट्रियल कार्सिनोमा इज हैविंग ऑलमोस्ट एंटायरली ग्लैंड्स and only 5% or less is stroma, that is solid growth, it is called well differentiated type 1 endometrial carcinoma or grade 1. okay. अच्छा, फ़र्ज़ करें कि जो अगर आपका एंडोमेट्रियल कार्सिनोमा टाइप 1 है, उसके अंदर 50% ग्लैंड्स हों, 50% ग्लैंड्स हों और 50% या उससे कम स्ट्रोमा हो, यानी कि सॉलिड ग्रोथ हो, तो इसको हम कहेंगे मॉडरेटली डिफरेंशिएटेड और ग्रेड 2. वेल डिफरेंशिएटेड में क्या था बेटा? अप टू 95% आपका ग्लैंड्स थे एंड ओनली 5% या उससे भी कम जो है सॉलिड ग्रोथ थी, यानी कि स्ट्रोमा था उसका, ठीक है. नाउ यू कैन अंडरस्टैंड द डिफरेंस बिटवीन बोथ. एंड द पुअरली डिफरेंशिएटेड और ग्रेड 3 इज व्हेन द सॉलिड ग्रोथ, यानी कि जो स्ट्रोमा है वो 50% से भी ज़्यादा हो और जो ग्लैंड्स हैं वो कम हो. ओके, नाउ यू अंडरस्टैंड दीज थ्री हिस्टोलॉजिक ग्रेड्स ऑफ type 1 endometrial carcinoma. Okay, now let me show you all these three grades very quickly. All these three grades. Number one, the well differentiated grade 1. Okay, so what do you think should be there? There should be lots of glands and very little stroma, very little solid growth. Can you see here in this picture? Can you see here in this picture? All these are glands. Okay, all these are glands. This from here, you know, all these are tubular glands. If I zoom into this picture, you can see all these are tubular glands, and between the tubular glands there is very little stroma, very little stroma, just 5% stroma, and you can see there are just tubules everywhere. So this represents 95% glands. Okay, this is what type, what histologic grade? When there are 95% glands and very little stroma, only 5%, it is well differentiated or grade 1. Okay, and now let me show you the moderately differentiated grade 2. Moderately differentiated or grade 2. Just a second. Yeah, moderately differentiated. What do you expect from this? What do you expect from this? There will be 50% glands, 50% stroma. Okay, can you see in this picture? If I zoom into it, yeah, you can see these are the glands, these are the tubular glands. Okay, tubular glands, and this purple part is stroma, okay. You can see again there is a gland, again there is a gland. Then so it means the stroma, that is the solid growth, and the glands, they are equal. Okay, 50-50. So that is your moderately differentiated grade 2. Now I will tell you the poorly differentiated one. What do you expect from poorly differentiated one? ग्लैंड्स बहुत ही कम होंगे और मोस्टली इसमें स्ट्रोमा होगा, सॉलिड ग्रोथ होगी मोस्टली इसमें. कैन यू सी एनी ट्यूब्यूल्स एनीवेयर? कैन यू सी ट्यूब्यूल्स एनीवेयर? No tubules at all. So that means there is no such glandular growth. You know, right from here till there, there is just purple growth, that is representing the solid growth, that is representing the stromal growth. Can you see? Rarely you can see some gland, rarely. Okay, this is the poorly differentiated variety, right? So I hope you got the concept, beta. One last thing you need to note is up to 20% of well differentiated endometrial carcinoma. I am talking about this. 20% of well differentiated endometrial carcinoma, they show some benign squamous differentiation. That means कि जो कार्सिनोमा होता है उसके अंदर स्क्वामस डिफरेंशिएशन देखने को मिलती है, यानी कि जो उनके सेल्स हैं बेटा वो स्क्वामस वैरायटी के हो जाते हैं। और ये चीज़ जो है वो बहुत अनकॉमन होती है मॉडरेटली और पुअरली डिफरेंशिएटेड एंडोमेट्रॉइड कार्सिनोमा के अंदर, ठीक है। सो दैट्स ऑल अबाउट बेटा टाइप 1 endometrial carcinoma, and we'll continue with the type 2 endometrial carcinoma in the next lecture. Okay, thank you so much. Class dismissed, beta.